Testing, testing. Hello everyone, this is Dr. Jawad. In this short video today, I'm going to talk about brain fog and inflammation on the brain. Okay? So with brain fog, a lot of my patients, and I get a lot of emails too, inquiring about what's the cause of brain fog. Now, brain fog, if you have lack of memory, if you are fatigued, if you have mood swings, okay, if you have lack of focus, your primary doc will oftentimes diagnose you as depression. However, that is the number one sign of brain fog. Now, brain fog is brain inflammation. Now, the thing about the brain is that 50% of the brain cells are called microglia cells. And microglia cells, that's our immune system. So those are immune-based. So when those get activated, that causes inflammation of the brain. Okay, so I'm just going to go down 6 methods that will cause inflammation of the brain and will give you brain fog. First and foremost, we take in a lot of the ingredients called aspartame and MSG. Aspartame is an artificial sweetener that's found in basically everything. Okay, and MSG is it's hidden in a lot of our foods. Okay, and they go under different names. The thing about aspartame and MSG is that it's called an excitotoxin. Now, an excitotoxin, again, it causes brain inflammation because it actually activates the microglia cells. The thing about the excitotoxins is that it pinpoints the part of our brain which was involved with learning and memory, and that's called the hippocampus. Now, the hippocampus of the brain is right about here. Okay, I'm just going to put H as a hip. So when you're taking in these products, you're activating the microglia cells, which actually decreases the function of the hippocampus, and this is where you get poor memory, poor learning. Okay? The next is gluten. Now, gluten is found everywhere. Now, back pre-1992, there wasn't that much gluten around. Okay? And plus, gluten was in a different form pre-1992. Gluten is the number one cause of leaky gut. Now, when we ingest gluten, we have what's called tight junctions. Tight junctions align the gastrointestinal tract, the epithelial lining, and what does, it acts as a protective barrier between the intestinal lining and our bloodstream. When you ingest gluten, okay, it's a protein, what it basically does, it unlocks those tight junctions and those food particles get within the bloodstream. Now, once it gets into the bloodstream, it causes an immune response. And it goes to the part of the brain, so what happens is it goes within the bloodstream and it attacks, there's a lining of the brain cells that align the brain, much like a cellophane wrap, called astrocytes. So the astrocytes are roughly, so here's your hippocampus. The astrocytes, again, it's like a cellophane wrap, and it wraps around the whole brain. Okay? And what it does, it just penetrates. It gets through what's called the blood-brain barrier. Now, the blood-brain barrier is a cellophane wrap that's used to protect the brain, which only a few substances like glucose and oxygen are allowed to pass. The thing about gluten is that it pulverizes the blood-brain barrier and actually attacks the brain, and this is where you get symptoms from gluten. Again, poor memory, maybe balance problems, maybe memory problems, maybe headaches, because again, the gluten is attacking the brain. Next is low blood sugar. Now, a lot of times with low blood sugar, people think of it as starving, okay? Thing about low blood sugar is that it's actually diagnosed, another name is reactive hypoglycemia. Now, what happens is that when you're hungry, okay, you have low blood sugar, so then you naturally want to eat something. Okay, you take a food product in your mouth, so you have an increase of blood sugar in the system, and then your sends a signal to the pancreas to release insulin. Insulin helps lower the glucose, so then what happens, then you get a crash. So then when you get a crash, then what do? Oftentimes people say, oh, you need a glass of juice, like orange juice, or some candy. So then what happens when you do that? Then you get another spike. Actually, I'm running out of space here. You get another spike, and then it takes a dip, okay? The situation occurs is, the problem is that insulin is being released in bursts. I'll say insulin okay, from the pancreas. The problem with the fluctuations with insulin is that it's actually pro-inflammatory. So it actually causes inflammation. So this is where you can get a lot of brain fog due to brain inflammation due to the insulin response. So again, and that's a big problem. Next is infections. Now, I treat infections much like leaky gut because it's kind of basically, it's almost the same mechanism. So when you have an infection like H. pylori, again, you have an infection of the mucosal lining of your stomach and or GI system. Again, the tight junctions get unzipped, the foods pass through, it goes into the bloodstream, hits the immune response, passes the blood-brain barrier, and again, this is where you get brain inflammation and brain fog. So again, it's H. pylori and Lyme are just two infections that are most commonly sought out, especially when it comes to the GI system. I know there's others out there, but again, you want to fight off the infections to help decrease brain fog. Next, very important, poor diet. Now, when I'm treating my patients, I always want to stress one thing in particular: fix your diet, because diet is key. When we have a poor diet, we lack the raw materials that our body needs to function. Now, 70 to 80% of our brain is fat. Our bodies are made of two things: proteins and fats. In particular, our brain, mostly fat. So what you want to do when you take in your good quality fats, you're taking in the good fat-soluble vitamins, which is A, D, E, and K. In addition, you always want to take in some really good fish oils in the form of EPA and DHA, because that will help decrease your brain inflammation and also the systemic inflammation overall your whole body. Also, when you take in the good quality fats, it stabilizes the blood sugar, and that's the main focus on decreasing inflammation. You want to stabilize blood sugar. You want to minimize the insulin response from the sugar that you intake because, again, insulin causes inflammation. So that's the main goal. A lot of times when I deal with my patients who have a really, really bad diet and they're just systemically inflamed, first and foremost, I tell them to cut out a couple things. Cut out the sugar, cut out the soda, and cut out the bread. They go through withdrawal symptoms for about 5 or 6 days, but by day 14, it's like a miracle. They feel overall about 80% better, okay? Because again, they're giving their bodies the raw materials it needs to fight off the inflammation that their previous dietary habits are causing. Next is very important, hormones. Now, cortisol is our stress hormone. Cortisol is released in times of stress from the adrenal glands, which are quarter-shaped glands that sit on top of the kidneys. Now, when you have increased cortisol due to stress response, it actually decreases the function of the hippocampus because it causes inflammation. Too much cortisol in the system due to a fight or flight response shuts down the hippocampus. Now, a lot of times I always say, for example, we all remember back when we were in school and we had test day and we had test anxiety. What happens when you have test anxiety? It zapped your brain because it decreased the function of the hippocampus because you had too much cortisol circulating in your system, okay, that causes brain fog. Another thing, with the postmenopausal women, when the ovaries shut down and then all the hormones are forced to go over to the adrenal glands because the adrenal glands take care of the sex hormones, you're having decreased estrogen. Actually, a decreased estrogen in the form of estriol, okay? So this is where postmenopausal females who have decreased estrogen because, again, the adrenal glands are not producing enough. This is where, again, it shuts down the hippocampus. They get brain fog, poor memory. Also, too, if you have too little estrogen, it causes inflammation in the brain as well, and brain fog. So what do you do? So this is what I always recommend. You know, again, clean up the diet. First and foremost, clean up the diet. Supplements. Supplements are key. Magnesium. Now, magnesium is a phenomenal supplement. It helps over 300 enzymatic reactions throughout the body. One of the things it does too, it helps stabilize blood sugar. Okay, so I always recommend taking magnesium. Also, turmeric. Turmeric is phenomenal to overall systemic inflammation, joint inflammation, gut inflammation. Turmeric's also good to help stabilize blood sugar. So I always tell my patients to incorporate turmeric in their supplement plan. Omega-3 fish oils. Omega-3 fish oils, again, helps decrease inflammation of the brain. Also, too, resveratrol. Resveratrol, phenomenal antioxidant, phenomenal for the GI system. Remember, the GI system, 80% of the GI system controls the immune response. So if you control the immune response through the GI system, resveratrol will help. And also too, ginkgo biloba, that's good too, helps dilate the blood vessels, it helps increase blood flow to the brain, which will help decrease systemic inflammation and brain fog. So these are just a few things that I recommend for my patients to help stabilize brain fog. Thanks for watching. See you in the next video. Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos. And thanks for watching.